performing CPR in newborn babies, I have to assess the upper score, which is a test done after 1 minute and 5 minutes after birth. Both upper scores are different. First minute shows us how the baby tolerates the birthing process. 5 minute after score tells us the baby's condition outside the mother's womb. So as I will be doing the cardiopulmonary resuscitation for this demonstration, we will assume that the baby has a low upper score. After determining the baby's low upper score, we will check the responsiveness of the baby by calling out its name and at the same time tapping the shoulder and rubbing the soles of the feet. Baby, baby! Hey, baby, baby! So this action will wake up the baby as they don't like this. However, this does not stimulate any response from the baby. We will proceed to the positioning of the baby on this back. So immediately call the attention for help to activate the code blue or doctor's quick. If necessary, open up the airway and suction further to promote breathing. There might be secretions that are blocking, so we need to remove them. The baby is still unresponsive, so this time I will perform a positive pressure ventilation or PPV, and it is a pediatric bag valve mask or BDM, which is a non-invasive method. I have to make sure that the BDM is attached to the oxygen cylinder with 100% optimum when cover entire mouth and nose with the mask. Allow 30 seconds of ventilation for 40 to 60 seconds breaths per minute, and make sure to check for the chest rise with each pumping. Doing this will successfully increase the survival rate of the baby. At this time, someone else would be attaching a cardiac monitor or a pulse oximeter to measure the baby's oxygen saturation, heart rhythm, and the baby's condition while we are performing with the resuscitation. If the baby's condition doesn't improve and heart rate is still nothing over less than 60, even after 30 seconds of performing PPV, we'll start by giving gentle chest compressions. So, by doing this, using the two thumb techniques, which you place your thumb in the center just below the nipple line and put your shoulder directly over your hands and lock your shoulder. Give 30 chest compression within 18 seconds or less. Each compression should be at least 2 depths of the chest to successfully raise the heart well, minimizing rib fractures, and make sure to allow the chest to recoil, and has this allowed the chest to fully expand to pull back into the chest and the cardiac tissues. So giving 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Give 2 rescue breaths. 1, 2. Give 2 rescue breaths using a bucket mask with less than 10 seconds after 4 cycles, and then switch roles with the rescuer and keep on doing CPR. If it is less than 60, then we're going to be doing the chest compression, assistance incubation, and giving meds. It's appropriate to discontinue the resuscitation after 10 minutes that the baby's heart rate remain unpredictable during the 5th set of compression, and switch the second rescuer and give 2 rescue breaths after performing 30 compressions. Give 2 rescue breaths. 1, 2. After that, both rescuers will resume high-quality CPR and they will switch roles. This time, the second rescuer will give 15 within 9 seconds or less, using 2 thumbs in a certain hand technique for 2 cycles, while the first rescuer gives 2 rescue breaths every after each compression. Give 15 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Give 2 rescue breaths. 1, 2. After 2 cycles, 2 rescuers will switch roles again. First rescuer will be given 15 compression, while the second rescuer will give the 2 rescue breaths. Give 15 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. The second rescuer will give the 2 rescue breaths. 1, 2. If your baby's heart rate is already more than 100, we'll discontinue the compression and do our post-resuscitative care, including wearing vital signs, continuing cardiac monitor, important pulse oximetry, and blood pressure. You also have to do airway and ventilation management of the temperature and put baby in a recovery position with holding like a football, like this. So when post-resuscitative care is given, proceed to documentation and include the time and the performance that we do our CPR.